Hi, Dr. Peterson here with Regions EMS. Today is Thursday, March 19th, 2020, and this is today's COVID-19 video update. The information is very dynamic, fluid, changing. This is what we know as of today, but could change tomorrow or even later this evening. For more information for the current resources, please check in regularly at our website, www.regionsems.com. You'll see a banner at the top that links to our COVID-19 information page, which will have this video, future videos, as well as supporting documentation, including a bullet point summary of the things I'm about to talk about. You can also subscribe to our YouTube channel, Regions Hospital EMS, to be notified of any future videos that we produce. So what I'd like to talk about today, several important topics. One, and first and foremost, we need to limit our exposure and conserve the available PPE that we have. We need to limit the number of providers involved in patient care for suspected infected patients. For these scenarios, it would be ideal to send in a single person as a scout to do an initial assessment and evaluate the patient for any risk factors before anyone else gowns up. If the patient is stable and can walk, there may be no need to involve anyone else. You should also work to maintain at least 6 feet of separation from the patient, even if you're gowned up in full PPE, unless you're performing necessary hands-on exam or procedures such as oxygen administration, checking a blood pressure, O2 sat, those kinds of things. First responders should perform an initial size up through a window or from the threshold of the door without entering the residence if possible, and stage for EMS arrival if the patient's mental status is normal and they are not in any respiratory distress. There's no need to enter that residence, that confined space, and be close to the patient if they appear to be stable from a doorway exam. If the patient does require transport but is not likely to require close monitoring during transport, you should really consider transporting them in the back of the ambulance alone without an EMS provider. I know that may seem very unusual, but with our current declaration of emergency, the EMS regulations that govern this have been suspended for the state of Minnesota. So it is perfectly legal right now to transport a stable patient in the back of an ambulance without a provider present. This will minimize time in close proximity to the patient and further protect you as EMS providers. On that note, we should also limit the riders in the ambulance unless the patient absolutely requires a guardian or a support person. Now, this would mean pediatric patients or vulnerable adults that may require a family member or a care provider to be present with them. Most emergency departments, in fact, I think all emergency departments in the metro, are now significantly limiting visitors and in many cases restricting them completely. Our PPE supplies, as many of you know, are critically limited. Different agencies may have different stockpiles available, but in general, we're running on days to maybe a week supply of face masks, N95 masks, and gowns. So we need to conserve these whenever we can. Now, regarding PPE, we stand by the recommendations of the CDC, the Minnesota Department of Health, as well as our own internal health partners experts. The minimum PPE recommendations for interacting with a potential COVID-19 patient includes a gown, gloves, face mask, and eye protection. For procedures which might generate aerosolized particles, such as suctioning, CPAP, nebulizers, BVM use, or invasive airway management, an N95 mask or a PAPR should be worn. We would also like to acknowledge, though, that there are some groups and experts out there advocating for N95 mask use with all suspected COVID-19 patients. They are concerned that we are underestimating the rate of aerosolization of infectious particles that the patients may be breathing. We will freely admit that there is still much unknown about this new virus, and that is what is generating this mixed information. However, the reality of our current situation is that our PPE resources are extremely limited. We will run out of N95 masks in the near future. While it may seem safer to wear an N95 mask with every suspected patient encounter, there is data that supports the droplet transmission belief rather than the airborne transmission belief, and we must be very deliberate with our PPE decisions in order to conserve the higher levels of protection, such as those N95 masks, for those patient encounters where they are truly needed. There are other ways that we can protect ourselves. The best option right now, like I mentioned before, is to use the scout model and only gown up one provider to make the initial patient contact. This person potentially could escort the patient to the ambulance, appropriately buckle them in the back of the ambulance, and if they're not likely to require any further interventions, then nobody else needs to be in the back of the ambulance, or even gown up and use another set of PPE. As well as significantly limiting the amount of providers that are potentially exposed to a possibly infectious patient. I will completely admit this situation is not ideal, but it is our reality, and we must adapt and be extremely thoughtful in our decisions and resource utilization. Along those lines, again, no nebulizers in the back of an ambulance. If you absolutely need to do a nebulizer for the patient, do it outside before you put them in the ambulance. If possible, don't even do the neb at all. I really don't think that there's a life and death situation where a nebulizer is going to make the difference. But if you do feel it's appropriate, do it outside of the ambulance so you're not aerosolizing those particles into your confined space in the back of the ambulance. We also, in these days, need to be encouraging non-transport or alternative transport options if the patient appears stable. Now, for our suspected COVID rule-outs, this includes normal oxygen saturations and a normal respiratory effort. And the patient should only be seeking evaluation for suspected COVID-19 infection. If they're concerned about other things, chest pain, cardiac, dehydration, that kind of stuff, then yeah, they should be transported. But if there is an option that is safe and reliable to get them to the appropriate facility for evaluation, we really need to encourage patients to consider those options. If you feel that the patient does not need an ambulance, but the patient disagrees with you, don't be afraid to contact MRCC and get a medical director involved to help make that decision regarding what's best for the patient, as well as what's best for keeping our public safety resources available and limit our exposures. Also, in order to minimize radio traffic, there's no current need to call into MRCC to report any low-risk, non-transport patient encounters. If you do feel you need to talk to a doc to try to convince a patient or run it by someone one way or another, that's fine. But right now, we don't need to be calling in the low-risk, non-transport patient encounters. Regarding testing and potential quarantine of suspected exposures, like I said yesterday, our current COVID-19 testing is extremely limited. We are unable to test anyone unless they truly need hospitalization for respiratory distress. We are trying to avoid hospitalizing COVID-19 infected patients unless they truly need respiratory support. However, you as public safety fall into a different category. Testing of exposed or symptomatic public safety professionals may be an option. More information will be available in a separate document posted on our website, as we have worked with our region's occupational medicine providers together to decide how to manage potentially exposed or symptomatic public safety professionals. That includes fire, EMS, and law enforcement first responders. There is no need, again, to self-quarantine if you are exposed to a possible COVID-19 patient, as long as appropriate PPE was used throughout the patient encounter. These are very low-risk exposures, and we need you in the workforce, not at home quarantining yourself for 14 days when it is almost a guarantee that you will not become infected by using the appropriate PPE. Also, we'd just like to acknowledge that these are stressful times. We need to keep an eye out for our own personal well-being and mental health, as well as those of our colleagues and coworkers around us. These are very unusual times that we're in right now that are bringing out a lot of emotions in a lot of people, a lot of fear, a lot of panic, a lot of irrational thought and decision, as well as a lot of rational, extreme thought and decision that is probably appropriate given our current circumstances. Stay tuned to our website, regionsems.com. We will try to give updates as they are available. Information on our website will be current as we have it. Obviously, there's a lot of news reports and media reports out there that may or may not have truth or validity. We aim to give you information that we believe has been vetted, is true, and is the current recommendations from all of the experts. Again, feel free to reach out to us if you have any questions. Stay safe. Do what you can. Protect yourself, protect your coworkers, do the right thing for the patient. We'll get through this. Thanks.